Good morning. This is Dr. Tarek. Today I am going to talk about heart blocks. These are electrical blocks that occur when electricity produced at the top chambers do not reach the bottom chambers. Consequently, the bottom chambers that pump the blood do not pump the blood that contains fresh oxygen and nutrients and hormones and everything. So the patient feel dizziness, shortness of breath, syncope, chest pain, and discomfort. To diagnose exactly what type of block is it, we need to have some knowledge, basic knowledge of ECG paper and ECG waves. We know there are small scale and large scale in ECG paper. This is the large scale. This is the large scale. This one B, C, D. This is large, and in between there are small scales 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So you go horizontally or you go vertically, up and down. It gives you time and it gives you voltage, how much voltage is produced. We also know by our physiology knowledge that one small scale horizontally from here to here gives us 0.04 second. That is the time. Horizontally it gives us time. So small scale horizontally from here to here gives us 0.24 second, and from here D to C one large scale gives us time 0.4 into 5, because there are 5 small scales. So that is equal to 0.20 or 0.2 second. It is also equal to 5 small scales. That is, we need to know about the ECG paper. Now we need to know how this ECG cardiac cycle is produced. PQRST. We know that there is an electrical generating system in the heart. It is produced at the SA node. Electricity goes to AV node, which is gateway to the ventricle. It enters the ventricle and then depolarize ventricle. So when first of all atria depolarize and it contracts. When atria contracts, it gives us P wave. Then there is a straight line, that is the time taken from SA node to AV node and some delay at the SA node, plus then it enters the ventricle. And then there is ventricle depolarization, which lead to contraction of the ventricle. When ventricle contract, they produce QRS on the ECG paper. And then ventricle relax, they produce T. So atrial contraction produce P, ventricle contraction produce QRS, and ventricle relaxation produce T. So this much knowledge we need to know. Another thing that I want to tell you is very important is PR interval, because heart blocks belong to PR interval. PR interval is the time from the beginning of the P wave to the beginning of the R wave. Here usually R is not there and Q is there, Q is not there and R is there. Whatever is the situation, Q is here or R is there, the name is PR interval, and normally this is 0.2 second or 5 small scales. 5 to 0.2 second or small 5 scale. So keep in mind PR interval normally is 0.5 small scales. Now we go to heart blocks. This heart block is three types: grade 1, grade 2 and grade 3, another one. So in grade 1, what happen is the PR interval from the beginning of the P to the beginning of the R wave, this is increased, but this is fixed. In grade 1, PR interval is increased more than normal, but it is fixed. It is not changing. It is not decreasing or increasing. It is fixed, whatever it is. 6, 6, 6. You see here, PR interval is 6. PR interval is 6 small scale. PR interval is 6 small scale. Followed by no beat is dropped. So this is PR of a grade 1 heart block, that PR interval is increased and fixed. It is not increasing or decreasing, increased and fixed, and there is no heartbeat drop. No beat is dropped. That is grade 1. Now grade 2. Grade 2 is of two type. Type 1 and type 2. Type 1 is known as Morbis 1 or Wenckebach phenomena, and type 2 is known as Morbis 2. So what happened in Wenckebach phenomena or type 1 grade 2 heart block is PER interval is gradually increasing. Gradually increasing means here, look at here, it is 6 moles here, it is 7, it is 8, and then one beat is drop. So gradual increase of PER interval, finally one beat is drop. Gradual increase of interval and one beat is drop. Gradual increase of PER interval and one beat is drop. Now I am going to tell you about grade 1 heart block. Now what happened in grade heart block is electricity comes. This is a wave of electricity. It comes and there is blockade. So it has, I am telling you why PR interval is increased. It takes a detour because it has to reach ventricle. So it takes a detour, and after taking detour, it goes to the AV node and then goes down. So that's why when traveling is increased, the time is increased, and time is known as PR interval. So, and the successive impulses which are coming from the SA node, they will follow the same detour. They will follow the same path. Here, same route they are going. That's why PR interval is increased but fixed. Increased due to detour and but fixed because successive impulses follow the same route. This is grade 1 heart block, and all the impulses are allowed to pass. Ventricle contract each time, so there is no beat drop. This is grade 1 heart block. Now most important is grade 2 heart block. What happened in grade 2 heart block is it is of two type, type 1 and type 2. Type 1 is known as Wenckebach phenomena or Morbis 1. PER interval is increased. It is gradually increased. What does it mean? Next beat come, next impulse come, it takes a longer detour and pass. Third wave come and it takes more longer. That's why PR as the travel is increasing, so PR interval is increasing, gradually increasing. Finally, a beat cannot pass through the AV node, so beat is drop. So there are two characteristics of grade 2 type 1 heart block, which is known as Wenckebach phenomena. Gradual increase of PR interval and a beat is drop. You see here 6 small scale, 7 small scale, 8 small scale. Every time it is increasing, gradual increase. Finally, this QRS is absent. After P wave, QRS not there. So gradual increase of PR interval followed by a heartbeat drop is known as grade 2 type 1 heart block, which is known as Wenckebach phenomenon. Now I go to grade 3. Grade 3 heart block. What is grade 3 heart block? The PR interval is increased and fixed. It is not gradually increasing or decreasing. It is increased. In normal we know it is 5. Here we see it is 6. 6 small scale, 6 small. Everywhere it is 6 small scale. It is increased than normal, but it is fixed. If it is 6, it will be 6, 6, 6. If it is 7, it will be 7, 7, 7. If it is 8, it will be 8, 8, 8. And finally, a beat is drop. This is P wave. Yes. This is P wave followed by QRS. Followed by no QRS. This is grade 2 type 2. There is PR interval is increased, but it is fixed. 666 and a heart is beat is drop. That is grade 2 type 2 heart block. Now I go to grade 3. What is grade 3? Grade 3, all the impulses which are coming from the SA node, they are blocked. None of them is allowed to pass. So there is ventricle, there is no relation between the connection between the atria and ventricle. And we know by our physiological knowledge, physiology knowledge, that atria has its own pacemaker and ventricle has its own pacemaker. Atria can produce electricity at the speed of 75 per minute, and ventricle can produce electricity at the speed of 20 to 40 beat per minute. So there is no relation between P and QRS. Like normally every P is followed by QRS and every QRS is preceded by P waves, and there is 1-to-1 ratio, but here it is disturbed. Everything is disturbed. Atria is producing electricity at its own, and ventricle is producing electricity at its own. Both are beating separately. There is no relation between atria and ventricle. There is no relation between P and QRS. Look here, like this. You will see P wave, P wave, P wave. You will not see any QRS complex. If you see, there is no relation between P and QRS. Here, this QRS is just after the P wave, and here it is just before the P wave. So there is no relation between P and T. P has its own speed and ventricle has its own speed and atria has their own speed, and there is no relation between P and T. This is known as grade 3 heart block. Now the reason for the cardiac heart block is cardiomyopathies. Cardiomyopathies, they weaken the heart muscle and they weaken these wires also. Wires which connect SA node with AV node and other system of the electrical system. These are wires, they are damaged by the cardiomyopathies. The most common cause of heart block is coronary artery disease with heart attack, myocardial infarction, or without myocardial infarction. They damage the wires, so there can be heart blocks. Next, there are some medicine which can cause heart block, that is calcium channel blockers, beta blockers, and digitalis and digoxin. Even heart blocks can be produced due to extreme anxiety. But remember, grade 1 heart blocks are innocent, but grade 2 and 3 can be dangerous. So they must be treated immediately, and one may has to be implanted with a pacemaker. That is all about the heart blocks. Thank you very much.